Welcome all. Welcome to this AimExcellence journal-based MCQ and JQ class discussion. The last AVD that we have uploaded regarding the acromegaly, which was a integrated medicine presentation. This particular MCQ actually brought many queries in the Facebook pages message boxes. So important thing is that we are going to give the explanation of this particular answer that we have given in this particular MCQ. A 42-year-old male patient presented with such presentation on inquiry reveals history of epilepsy and cataract, most probable causes. So important thing is that you have to understand, figure it out by seeing this particular picture. This is a picture-based MCQ which have not been asked till now, but right nowadays repeat questions are going to be less. So this is a very interesting topic. This is cutis verticis gyrata. So here this particular patient is coming up with this kind of clinical presentation, which is having a cerebriform fashion in the scalp. This is called cerebriform fashion presentation. And they have fold and furrows. So you see the hairs are lining up out here. They are actually originating from the furrows, and on the folds there is presentation of alopecia. This is a very interesting clinical topic, clinical mark that you should know. This is where there will be alopecia, and the pink arrow which is pointing towards the furrows where the hair still grows. So this is cutis verticis gyrata, and the person out here who is a 42-year-old male presented with such presentation, and on inquiry he have given the history of epilepsy and cataract. So there are neurological manifestation and ophthalmological manifestation. So we have given a little hint in that every video, because that was actually focusing on acromegaly. That was a video of acromegaly, but right now we are going to give you a little detail about cutis verticis gyrata. Cutis verticis gyrata cutis verticis gyrata practically can be divided into two types. One is primary and another is secondary. The primary cases can be divided again into two types: primary essential and primary non-essential. In primary non-essential, you will have neurological manifestation and ophthalmological manifestation. Neurological manifestation and ophthalmological manifestation. Most common ophthalmological manifestation is cataract, another common finding is retinitis pigmentosa. In neurological manifestation, we will find epilepsy, seizure, and cerebral palsy. There is other two options like Beer-Stevenson Curis gyrata syndrome and acromegaly. They are actually from the secondary. Their causes. They are the secondary causes. Acromegaly we already have discussed in our AVD video, and acromegaly is the most common secondary cause of cutis verticis gyrata. This is the most common secondary cause of cutis verticis gyrata. There are some interesting features regarding Beer-Stevenson cutis gyrata syndrome. You can remember few things. It is autosomal dominant. There will be craniosynostosis. Wide eyes, and also there will be nasal stuffiness, and so we have understood this CVG, cutis verticis gyrata, can be differentiated into the primary and secondary cause. And from the primary cause, we can be divided into primary essential and primary non-essential. And of secondary, there are few causes. Acromegaly is the most common cause. Apart from that, there are some neurocutaneous syndrome like tuberous sclerosis. There is a connections with the Downs and Klinefelter. Neurofibromatosis, amyloidosis. These are the important secondary causes. Regarding cutis verticis gyrata, it is not genetically related. No inheritance pattern out here. No inheritance pattern. The number of cutis verticis gyrata folds are from 2 to greater than 10, and chiefly it is located antero-posterior. From the furrows, as we have shown, there will be hair growth, and there can be collection of sebum and sweat, which can give a malodorous presentation. Offensive odor. And treatment is plastic surgery. We have to operate it to correct the furrows and the folds. We have to operate it. This is the plastic surgery, this is the treatment of choice. At times we can give the dermal filters, but plastic surgery is the treatment of choice. Hope you right now enlightened about cutis verticis gyrata. There are also important symptoms like cutis laxa, which is having a genetic predilection. So that is something we are not going to talk in this particular video. That for that there are other videos already in the YouTube. So if you like our presentation, continue to follow us in the Facebook, Twitter and YouTube. And if you like us, if you have any queries, write to our Facebook pages, message boxes. Thanks for your support. Thanks for being with us. We really value your support, and we will try to come up with interesting cases and journal-based MCQ. This is a journal-based MCQ because quite a few journal the example of such presentation with neurocutaneous manifestation is there, like tuberous sclerosis, and also as acromegaly is the most common secondary cause, there are cases which have been registered and published in the international journals. So with this particular presentation, and we have to remember this, it can have a generalized and sporadic presentation. Generalized and the sporadic presentation, it have two kind of presentation, generalized and sporadic. So primary can be generally generalized, so before signing it off, we are going to show you one sporadic presentation picture and also the CT image, how it is being shown in the CT image. Yes, in the derma condition also can at times need the CT presentation. Here you are getting a clearer idea how the hair is growing from the furrows, but in the folds there is alopecia. And also the CT image, dermis and subcutaneous layer both are involved, dermis predominantly and at times subcutaneous layer, and this appearance is known as cogwheel appearance. Cogwheel appearance. For the primary cases, we also have to do the MRI to rule out any other neurological manifestation underneath. So this is cogwheel appearance. Hope you like our presentation. If you like us, be with us, follow us, support us. We really need your support. Thank you.